All of those things are typically how PCOS is treated, but none of these things actually get to the root cause of PCOS symptoms. And it can create shame. It can make women feel like they're the problem. It makes them feel really dismissed and blamed and create a lot of fear, especially around fertility and coming off of birth control, if that's what's been, suggested. Hello. Welcome back to another episode of She's in Sync. Today, I'm going to be diving into everything PCOS and birth control. So you're in the right place if you have PCOS, polycystic ovarian syndrome, and you have been told that birth control is your only option. Maybe you were put on birth control as a teenager to quote unquote manage your PCOS. If you are terrified of coming off and terrified of symptoms coming back, so maybe it's hair loss, facial hair growth, acne, irregular missing cycles, maybe you want to come off and start a family soon and you're scared of infertility and you are just really, really scared of what to do. So I just want to first normalize that fear, and a core message I want to really just say right out the gate is that birth control does not fix PCOS symptoms. So if you were put on birth control to fix PCOS or to manage those symptoms, I just want you to know that the deeper root causes of those symptoms have not been explored. And that's what we're going to be going over today. So we're going to dive into everything functional lab testing to uncover what your root causes of PCOS symptoms are, how to identify them, what to do about them so that you can have a smooth transition off birth control without PCOS symptoms rearing their ugly head, or minimize symptoms as much as possible, and really leave finish listening to this podcast with confidence, knowing that there are things in your control that have not been explored yet. Because PCOS is not just you have cysts on your ovaries, or you need to cut carbs. It's not a blood sugar or weight issue. It's a whole body metabolic and hormonal condition. It quite literally impacts almost every single body system. So obviously blood sugar, but also inflammation, stress hormones, your gut health, thyroid function, ovulation, fertility, all of those things are at play that can drive PCOS and that play off of each other. So common symptoms of PCOS are irregular missing cycles, delayed ovulation or anovulation, not ovulating at all on your period. And just as a reminder, you can ovulate without bleeding and you can bleed without ovulating. Acne, hair loss, hirsutism, so having hair where you're not supposed to as a female. Insulin resistance, weight struggles are huge, skin tags, dark patches on your skin, mood disorders, anxiety, and depression, as well as, of course, cysts on your ovaries. And an important nuance I want to say too is that you can have PCOS without being overweight, and weight gain is often a symptom of metabolic dysfunction, not the cause. So I am a big advocate for overall health enhancement versus just focusing on weight loss. And there's a lot of shame with women who I've worked with PCOS because they've been told for so long it's a weight problem, that they need to get a grasp on their weight. They need to exercise more. They need to restrict carbs. They have no self-control. They need to just be so strict with themselves. And that's not sustainable for anyone. And that can also lead to all the things we just talked about with all the symptoms of PCOS and the metabolic issues that can fuel those things. And typical treatments for PCOS are birth control, which we talked about, restrictive dieting, carb fearing, weight loss recommendations, all of which we just discussed, metformin, spironolactone. All of those things are typically how PCOS is treated, but none of these things actually get to the root cause of PCOS symptoms. And it can create shame. It can make women feel like they're the problem. It makes them feel really dismissed and blamed and create a lot of fear, especially around fertility and coming off of birth control, if that's what's been, suggested. So I want to really dive into the how PCOS is misdiagnosed as well. So PCOS is diagnosed using the Rotterdam criteria, which requires 2 out of the 3 things to be true: irregular absent ovulation, elevated androgens, and then polycystic ovaries found on an ultrasound. However, having cysts on your ovaries or having absent or irregular ovulation, having elevated androgens, those things don't necessarily mean you have PCOS. And I see all the time PCOS is kind of thrown out there as oh, well, your period's missing or it's prolonged or you're not ovulating and you have cysts on your ovaries, you have hormonal acne, it must be PCOS. When in reality, it might be a hypothalamic amenorrhea situation where someone is under eating and over exercising, or their body is stressed, there's trauma of some sort, whether it's physical, emotional, mental. And that is preventing ovulation. And that is fueling, symptoms that present like PCOS, like acne, missing or irregular periods, things like that. And so I just want to lay that out there because while there's this criteria for diagnosing PCOS, a lot of times I see it thrown out there, but it may not be the full story. And PCOS is so complex. It's like simple and complex at the same time. Like it's simple in how we treat it. If we take a step back and just kind of look at like what we need to do about it, I think people just make it way more complex because doctors make it complex in what they say. But it's also a complex, condition because there's so many different facets to it. So when I'm looking at someone's labs, I'll use a client. I just did a lab review for her yesterday, VIP client of mine, and she was told by her doctor she has PCOS because her anti-Müllerian hormones was elevated. This doesn't necessarily mean that she has PCOS, and she has some acne, and she also has a irregular missing cycle since coming off birth control. So anti-Müllerian hormone is a key hormone used to assess ovarian reserve and reproductive health. And yes, you can have elevated levels with PCOS, but it doesn't automatically diagnose PCOS. And when I took a look at her other labs, I was like, I'm not seeing insulin resistance at this point. I'm not seeing high testosterone. I see stress. I see undernourishing because I took the time to do a deep dive into her nutrition intake versus no doctor had done that before. And I knew she was under eating, specifically carbs, specifically fats, which are really important for hormones and for periods. And she has a really active job. And so what I told her is like, it might be PCOS, but like I'm leaning more towards hypothalamic amenorrhea in this situation. And I explained why. And that can be really overwhelming when you've been told one thing and like you need to restrict carbs and you need to lose weight. This person is not underweight or overweight. And according to the BMI, which I have my own qualms with, but I supported her in that and being like, yeah, I'm sure this is really confusing. I'm kind of telling you to do the opposite things of what you've been told. And that's why women see results with me after they've seen so many doctors, because they've tried the conventional route, they've worked with other providers, and they're just not uncovering all the deeper imbalances that we're uncovering together. So I wanted to share that because if you're listening to this and your PCOS has been thrown out there for you, this is why it's really important to work with a women's health expert who has worked with women with both hypothalamic amenorrhea and PCOS, like myself, and does the deeper digging, assessing your nutrition, assessing your labs to really truly understand what the deeper root cause is. Because while we would treat them both similarly in the respect of based on your lab work, treating each individual root cause that we find, it's also really important to differentiate and understand that those are two very separate things, but they can have similar symptoms in terms of cysts on ovaries, prolonged anovulatory cycles, missing periods, androgen fluctuations, things like that. Okay. So let's talk about the root causes I look at with my clients with PCOS. And I look at this with all my clients. And so you'll notice if you've listened to other podcast episodes that I talk about these things as well. And so this is where with PCOS, it gets overcomplicated when in reality, it's like the things that I'm working on with all of my women, okay? So I want to start with blood work first. What I'm looking for in blood work with PCOS is fasting insulin, because fasting insulin is really, really important. And my reference range for an optimal fasting insulin is 4.5 to 6. Versus if you look at conventional standards, it's like upwards of 15, 14, something like that. It's really high. So I oftentimes will flag high fasting insulin when conventional doctors won't. And this is something we really, really want to get blood sugar and fasting insulin in check. And you might have normal fasting glucose, but an elevated insulin. I do see this a lot. High insulin stimulates ovaries to produce more androgens, and this can contribute to acne, hair growth, irregular ovulation, and this can also contribute to sugar cravings. blood sugar dysregulation, which can lead to mood swings, anxiety, depression, insomnia, waking up at night. It creates inflammation in the body. It's a stressor on the body. So this is really something we want to get in check. And this would be not eliminating carbs. This would be strategically incorporating fiber-rich carbs for the most part, still enjoying things like ice cream and sweets and stuff in moderation, and also making sure we're getting enough protein and enough fat to balance blood sugar. The next one is testosterone and sex hormone binding globulin. So sex hormone binding globulin binds testosterone. So it's oftentimes low in people with PCOS, which leads to more free testosterone circulating in the body, which can contribute to PCOS symptoms. Again, there's different kind of types of PCOS. I don't want to like type people, but I want to look at the person as a whole. But just to break the myth of like it being a blood sugar issue, some people, they don't have a testosterone driven or an androgen driven PCOS. Just like some people, they may not have, blood sugar dysregulation. And that's when we really have to look at what's actually going on here. Is this actually PCOS? So like the client I spoke about earlier, her testosterone levels are fine. So her acne isn't driven by high androgens. I suspect it's driven by underfueling and low minerals because we did her HTMA and her minerals were super depleted. It's very clear that she's very stressed. Okay. DHEA and stress. This is a perfect segue into the other thing that I test for in the blood. So DHEAS is an adrenal marker, and it's the storage form of the hormone DHEA, and it's often elevated or it could be depleted in PCOS clients. When it's one or the other, this shows chronic stress and cortisol dysregulation, which can impact blood sugar, it can impact ovulation, and it can also impact androgen balance. So we want to look at those markers. And then iron overload. Readjusting myself here. Iron overload. This is huge in PCOS. I see iron overload a lot, and you have to get a full iron panel here. So ferritin alone or a serum iron alone is not enough to fully assess iron recycling or iron overload. So when I'm looking at an iron panel, I want to look at transferrin. I want to look at total iron binding capacity, serum iron, percent iron saturation, as well as ferritin. And then I also want to see other minerals and vitamins that are important for that. So copper, zinc, vitamin C, vitamin A, those are all important for the iron overload, iron inflammation piece, and iron recycling. So there's a huge link between PCOS and iron overload. And sometimes we can work on this with nutrition alone, and sometimes this requires a blood donation because if we have iron overload, it's going to cause inflammation, and that is the stress on your body, and that can trigger cortisol, that can trigger things like acne, heavy periods, for example, too. So if you're not getting consistent periods, but they're really heavy and painful when you have them, that could be a sign of this. And so this is also something that we want to look at that a lot of doctors aren't looking for with PCOS, or that is just going undiagnosed for years. One final thing with iron overload too is if you have iron overload, it can feed bad bacteria and bad pathogens in your gut, like candida, which can exacerbate PCOS symptoms too. So this is where taking a full body approach is so important. So next I want to move on to I guess this is still in the blood. Never mind. Like nutrient deficiencies. So I assess nutrient deficiencies in the blood, but also on the HTMA, the hair tissue mineral analysis. But common deficiencies in PCOS are zinc, vitamin D, vitamin A, magnesium, and B vitamins. And I also want to note that all of these things are made worse and depleted by birth control. So here's another example of how birth control negatively impacts these things. If you're taking the placebo pills, those have iron in them. That can also exacerbate iron overload, symptoms that we just talked about. So see how this it irks me so much that women are just put on birth control because it's literally making things worse more often than not. But if you have nutrient deficiencies, that's going to impact insulin sensitivity. So for example, magnesium is really important for blood sugar regulation. It's going to impact egg quality if fertility is a goal of yours, skin health, ovulation, of course, and then thyroid function, which is important. And then the last piece I look for in the blood is thyroid, a full thyroid panel, not just your TSH. That does not give us any information, but I want to look at a full thyroid panel. So I want to look at T3, reverse T3, T4, TPO, and TG antibodies, and TSH to get a really full picture of what's happening in your thyroid. And like I said, there's a huge connection between hypothyroidism and PCOS. And thyroid dysfunction can worsen irregular cycles, infertility, weight changes, fatigue, and hair loss. So this is something that we really want to assess with PCOS and root causes. Moving on to gut health. So I run blood labs with my assessing all those things we talked about with PCOS. And then I also run a GI map, which is a comprehensive stool analysis. This will help explain the gut hormone connection with PCOS. And gut health impacts estrogen detoxification, inflammation, insulin sensitivity, and nutrient absorption. So a lot of women with PCOS, they have stuff going on in their gut. This could be low levels of good bacteria. This could be too much bad bacteria, pathogen overgrowth. Candida is a really big one with gut health, and inflammation in the gut and low stomach acid. So when you have low stomach acid, you're not absorbing the nutrients from the food. You're not digesting your food. So I remember one client who I did a GI map with, she had iron overload and she had candida. So the iron was feeding the candida. So it wasn't a matter of just eradicating the candida. It was like, we have to get this iron under control so it's not just feeding the candida, so the candida is just like coming back. And then she also had really low levels of good bacteria. So we wanted to address all of that in our time together to make sure no stone was left unturned and really heal her body for the long term. So if there's anything going on in the gut, this can lead to cravings, poor estrogen clearance, which can lead to hormonal imbalances, acne, inflammation, and also, of course, like digestive issues too. So like constipation, diarrhea, bloating. The next test I would run if I had PCOS and that I run with my clients is a hair tissue mineral analysis. So if you're new here, an HTMA is looking at your long-term mineral patterns and your stress response. And unlike blood work, it shows 3 months worth of data just from a small little sample of your hair. So it's giving us insight into what minerals are you low in, what minerals are you burning through, if there's any toxic metals, which are creating a burden on your body, and also how your nervous system is functioning, how your thyroid is functioning on a cellular level, your adrenals too, which is really important for a stress response, which is really important in PCOS, that no one's talking about stress. No one likes to talk about stress. Like, that's not a sexy thing to talk about. And common patterns I see with PCOS are low magnesium, low sodium and potassium. And if you have low sodium and potassium, this can lead to low stomach acid that we just talked about, which can lead to the proliferation of bad bacteria, poor digestion, all that kind of stuff. Low zinc and selenium, adrenal stress, sluggish thyroid, which we talked about already with blood labs, and then the heavy metals as well. So minerals are foundational for every single system in the body. Blood sugar, detox, food digestion, ovulation, thyroid, nervous system regulation. And so this is step one when I'm working with clients with PCOS, is getting their mineral levels repleted and working on their stress response. Then after that, we can move into, sexier gut work, and we can move into, iron, like blood donation for supporting iron overload, things like that. But if we don't support your minerals first and your stress first, it's just, you're going to have quick wins, but it's not going to be lasting. And that's not what I'm about. I'm about giving my clients lasting results so they don't have to keep seeing me and doing these things over and over again. I want them to have the tools and the strategies for lasting health, not just quick wins. Quick wins are great. I love that. And we want quick wins and we want sustainability. The last thing I'll talk about with testing and root causes is iodine. Iodine is critical for thyroid hormone, for ovulation, for breast and ovarian health, and for metabolism. So many women are deficient in iodine. I talked about this last week in my podcast about water and acne and the intricate relationship between fluoride and iodine and acne. And I also, want to bring that here because I've never had a client who is deficient in iodine that I've tested. And I've tested dozens and dozens of women at this point. Everyone's deficient in iodine. And it's so, so important, especially after long-term birth control use, because low iodine can contribute to sluggish thyroid. It can contribute to acne and other skin conditions. so much that overlaps with PCOS. So iodine is a huge thing that I work on with my clients. And this isn't something of just take an iodine supplement. Do not do that. You want to work with a trained professional who understands iodine. And so that's just something I really want to caution you with, but iodine is so helpful and there's a process to it. So iodine is only something I do in my VIP coaching program because it's a 10-week protocol. So, and we have to make sure your foundations are ready for iodine or else it will make, your symptoms worse versus better. That's why you want to be really strategic with it and work with an iodine trained professional. Okay. Do not just take iodine. It's not going to work. Promise. So all that being said, hopefully now you realize there are so many root causes to your PCOS that probably haven't been explored yet. And hopefully this gives you comfort, it gives you peace of mind to really realize that, you're not alone in this, that I worked with several women with PCOS and were able to transition them off birth control without their acne coming back, with their hirsutism improving, without hair loss, healing their gut, stabilizing their blood sugar, making sure they're eating enough, not demonizing food or restricting carbs, really supporting their nervous system with personalized nutrition, supplements, and lifestyle changes that are realistic. Okay. So healing PCOS should not feel like a punishment. It shouldn't feel like something that you're doing wrong. You just probably haven't had the right support or the right understanding of what your root causes of PCOS are. Or maybe you resonated with do I even have PCOS? Because maybe it's not actually PCOS. And again, that's where it's really important to work with someone who fully understands both PCOS and hypothalamic amenorrhea, because a lot of times they can be misdiagnosed, okay? So you're not broken. Your body is communicating, and PCOS symptoms are often reversible and they're certainly manageable when root causes are addressed. And there is hope if you want to come off birth control and conceive, and beyond symptom management or symptom suppression, it's really about getting to the root cause and helping you feel better for the long term with your PCOS, okay? And this is exactly why I run comprehensive functional lab testing with all of my clients before they come off birth control, or if you've come off birth control and you're struggling with your PCOS symptoms, or you're curious if that's even the root cause at this point, what's really driving the symptoms underneath the surface. And that drives our personalized healing plan to support a smooth transition off birth control and or healing your hormones naturally after birth control, while also optimizing fertility in the process. So if this episode resonated with you, please give me a shout out on Instagram. I would love to hear from you. Share it with a woman in your world who needs to hear this as well. And if you're interested in getting functional lab testing and or one-on-one coaching support around PCOS or around any of the symptoms we talked about today, feel free to fill out the link below to hop on a free discovery call. This is truly a no pressure conversation about what you've been through, what symptoms you're experiencing, what's worked, what hasn't worked, where you want to go, what do you want your life to look like, what do you want your health to look like, and determine together if working together is the perfect next step for you. So if that resonates, feel free to hop on a call together. Just fill out the application below. I would love to chat with you more. And until next time, friends, stay nourished.